Welcome to the Explainer. Today, we're going to break down the exact medical protocol for something that is, frankly, terrifying. What to do when a child can't breathe. I want you to picture this scene. A child is in distress. They are struggling for every single breath. It is a nightmare scenario for any parent, for any first responder. We're going to use a real-world medical guideline to walk through exactly what to do, step by critical step. So you might think the first move is to jump in with drugs or some big procedure, right? Well, not exactly. The protocol actually starts with something way more fundamental: observation. The whole initial assessment is about one thing: gathering clues, and fast, to figure out what is actually going on. Okay, so first responders are trained to use their eyes and their ears. They're looking for those physical signs, like the muscles in the child's neck or between their ribs pulling in with each breath. That's a huge sign of increased work of breathing. They're listening really closely for specific sounds, checking for a super fast heart rate. Every single one of these signs is another piece of the puzzle. Now, while they're observing, they're also asking questions. And this isn't just small talk. This is a rapid-fire investigation. Does the child have a history of asthma? That is a massive clue. Did the parents already try a home nebulizer? Knowing that is so important because it helps you understand how severe this is. This history is absolutely vital for figuring out the why behind the crisis. All right, now we get to the first two concrete things you actually do, and these apply no matter what the cause is. First, you give them oxygen. Get those saturation levels up to 94% or higher. Second, and this is so important, you let the child find their own position of comfort. If they want to sit up, you let them. Forcing them to lie down could actually make things worse. These steps are simple, they're immediate, and they really work. Okay, so oxygen is on, the child is as comfortable as they can be, and now we get to the most critical point in the entire protocol. This is it. This is the moment where a single observation, one sound, determines the entire path of treatment. It's the fork in the road. So what is this crucial point? It's all about one question. Is the sound a wheeze or is it stridor? A wheeze is that classic high-pitched whistling sound that comes from deep down in the lungs. Think asthma. Stridor, on the other hand, is this harsh, raspy, high-pitched sound that's coming from the throat, the upper airway. Think croup. So one is low, one is high, and where that sound is coming from tells you exactly where the problem is, and it changes everything. And based on just that one sound, the protocol splits into two completely different life-saving treatment plans. So let's follow both of those paths and see how this one single clue dictates every single action that comes next. So let's first go down the path for a child who is wheezing. This almost always points to an asthma-like emergency, right? Where the small airways deep in the lungs are clamping down. The treatment here is like a calculated 1-2-3 punch. First, you hit it with albuterol. That's the bronchodilator that works fast to open up those tight airways. You can even add ipratropium to give it an extra boost. But opening the airways is only half the battle. Next, you got to bring in a steroid, methylprednisolone, to calm down all that inflammation that's causing the problem. And for the really, really severe cases that just aren't getting better, there's even a fourth option: magnesium sulfate. And this just shows you how incredibly precise pediatric medicine has to be. The steroid dose isn't one size fits all. No way. It is calculated at 2 milligrams for every single kilogram of the child's body weight, up to a max of 125 milligrams. This makes sure that the dose is powerful enough to work, but also perfectly safe for a much smaller body. Okay, so let's rewind and go back to that fork in the road. What if the sound wasn't a wheeze from the lungs, but that harsh, high-pitched stridor? Well, that tells us the problem isn't deep down, it's up high in the throat. It's an upper airway obstruction, and that usually means croup. And the game plan here is totally different. Notice anything missing? Yep. Albuterol is gone. The first-line drug after the steroid is nebulized epinephrine, delivered as a medicated mist. Why? Because epinephrine is just incredible at rapidly shrinking the swollen tissues in the throat that are causing that blockage. The goal is to create space for air to pass, and to do it fast. Okay, now here is a piece of advice from the protocol that sounds a little counterintuitive. It says, avoid IV placement. In an emergency, you'd think getting an IV is the first thing you do. But for a child with croup, the stress and the agitation from that procedure can actually make the airway swelling worse. This is a perfect example where sometimes doing less is actually doing more. And here it is, the specific tool for this job: 3 milliliters of nebulized epinephrine. This exact dose, delivered as a mist, is this powerful, unique part of the stridor protocol. It's designed for one thing: rapid, targeted relief of that dangerous upper airway swelling. All right, so we've just walked through a pretty complex decision tree with two very different paths. So let's distill this entire complicated protocol down to the most essential, memorable points, the things that really form the core of the whole response. If you remember nothing else from this, remember this. It always, always starts with assessment. You look for signs, you ask for history, oxygen and comfort are your immediate first moves, every time. Then comes the big one, the critical question. Is it wheezing or is it stridor? Because the answer to that determines your primary medication. Wheezing gets albuterol to open the lower airways. Stridor gets epinephrine to shrink the upper airway. That's it. That's how you make this impossibly complex decision manageable under extreme pressure. And that right there is the power of a great protocol. It takes a chaotic, terrifying situation and it boils it down to one critical decision point. It gives you a clear path forward when everything feels lost. And the answer to that single question, wheezing or stridor, that can be the difference between a crisis resolved and a tragedy.